the 2025 Annual Benefits Open Enrollment Meeting for Build a Sign. My name's Rebecca Hawes, and we are going to go through your benefit options for that May 1st effective date. Your annual benefits open enrollment period starts today, March 17th, and goes through March 28th. Benefits elected during your annual benefits open enrollment will become effective May 1st, 2025, and those benefits will remain in effect through April 30th, 2026, unless you have a qualifying life event. As a reminder, this is your one time per year that you can make a change to your benefit elections without a qualifying life event. So when I state make a change, maybe you want to add a dependent this year that wasn't on your plan currently. Perhaps you want to move from the PPO copay plan over to the high deductible health plan or vice versa. This is your opportunity to make changes such as those described. What happens if you need to make a change during the year? In order to make a change after May 1st, you must have one of these qualifying life events that we have on the screen. These events include things such as marriage, birth or adoption of a child, if you or your dependents lose other coverage. All of these would be considered a qualifying life event, but you must notify your HR office within 31 days of that event date in order to make the change. For example, I have a baby on June 1st, and I neglect to let my HR team know that I want to add that baby onto my medical plan until I start receiving bills in September. June 1st to September, there's been more than 31 days from that qualifying event date. You would not be allowed to add that newborn on. You'd have to wait until open enrollment the following year to do that change. Benefits overview. The good news is we're staying with Blue Cross and Blue Shield this year for the medical, dental, and vision. We're staying with Lincoln Financial for the basic life, voluntary life, disability, and the EAP program. The critical illness and accident are also staying with Blue Cross and Blue Shield of Texas. And the flexible spending account and HSA are staying with WEX as well. There has been a change to one of the medical plans, and that is due to the IRS regulations. I'm going to skip ahead right here so we can point that out. This calendar year deductible for the high deductible health plan has increased by $100, going from $3,200 to $3,300. But other than this change on the deductible, all other benefits are staying exactly the same for the medical plans. As a reminder, you have 3 plans available to you. You have the high deductible health plan, and then you have the PPO plans that we refer to as the base or buy-up plan. All 3 of these plans utilize the exact same national Blue Choice network. They all have in and out of network benefits. They are all going to cover your preventative health or preventative care at 100%. Things like annual adult physicals, flu shots, mammograms. If it's coded as preventative care, then it would be covered at 100%. All of these plans also include what we call virtual visits. Specifically for the PPO plans, the base or the buy-up, there is a fixed copay for office visits and prescription drugs. The deductible does not apply. On that high deductible health plan, that high deductible health plan has all services going towards the deductible, with the one exception being preventative care. The high deductible health plan allows you to make tax-free contributions into a health savings account. And the high deductible health plan is going to have one of the lower premium deductions from your paycheck. Back to this medical plan comparison. Again, we stated that all three of these plans are staying exactly the same, except for that high deductible health plan with the deductible change. On that high deductible health plan, as a reminder, once I meet that $3,300 individual deductible or $6,600 family deductible, all of my expenses are picked up at 100% for the remainder of the calendar year. If I'm going into this high deductible health plan for the first time, and I'm used to having an office visit as far as my primary care office visit, that will change, and I will now be responsible for 100% of that contracted rate if I'm using an in-network provider until I reach my deductible. You will note here on wellness exams, it says 100% under that high deductible health plan. There's no deductible that applies for those claims that come in and are coded as wellness care or preventative care. Again, those examples are things like flu shots, well baby child checkups, mammograms, annual adult physicals. Again, still on this high deductible health plan, if we look at our prescription drugs, it says 100% after deductible. I'm paying 100% of that contracted rate for that medication until I reach my $3,300 deductible. Once I reach my deductible, I am picked up at 100% for the remainder of the calendar year. Let's focus on the base plan and the buy-up plan. The big difference on these two plans is going to be the deductible and out-of-pocket maximum. That base plan has a $3,500 individual deductible, $7,000 per family. The buy-up plan has a $1,500 individual deductible, $3,000 per family. Once I reach those deductibles, my coinsurance states 80%. That means Blue Cross and Blue Shield will pay 80% of the remaining charges and I'm responsible for 20% of the remaining charges until I reach my out-of-pocket maximum. Once I reach my out-of-pocket maximum on either the base plan or the buy-up plan, the plan picks up at 100% for the remainder of the calendar year. On both the base and the buy-up plan, they have the exact same office visit copays, $25 for primary care physician. That's going to be our pediatrics, our internal medicine, our family practice, or general practice. Specialist office visit is $50. That's going to be anything such as a allergist, cardiologist, oncologist. These are just examples of different specialists. On both the base and the buy-up, my deductible typically does not apply towards my office visit. Typically, I'm going into the office visit and I'm only going to be paying that office visit copay. The very few times that deductible is going to apply is if I'm going in for something that gets coded for an outpatient surgical charge. That can include something as simple as going in and they remove a mole or a freckle from my skin. And to me, it's not surgical, right? They're just using a little razor blade and removing that and sending it off for a biopsy. But that is considered surgical and it does go towards my deductible. Same with the high deductible health plan. When we look at wellness care, that's covered at 100%. There's no deductible copay that applies as long as that claim is coming in as preventative care. Prescription drugs, again, the deductible does not apply on the base and the buy-up. Depending on what tier level my medication falls under will determine the amount that I have to pay. For example, generic drugs covered at $10, preferred brand name is $30, and non-preferred brand name is a $50 copay. If I'm getting one of these specialty medications, those are typically going to be high dollar medications. Some of the medications we see on TV advertised at night, it's going to be medications that cost typically over $1,000. I'm responsible for 25% of that contracted drug rate until I reach my out-of-pocket maximum. This next slide just goes into a little bit more detail about the plan and what it covers. Again, there's been no changes. These are the exact same plans that we have today. I do want to point out urgent care services. Really encourage you to use urgent care if it's not a life or limb threatening event. On that base plan, it's a $100 copay. On the buy-up plan, it is a $75 copay. On the high deductible health plan, it's going to be 100% after deductible. Virtual visits, another term for this is going to be telemedicine. With a virtual visit, you're able to seek care from a doctor either from your mobile phone or your computer without an appointment. Typically, these visits last about 10 to 15 minutes. The great part is the doctor can even write you a prescription if needed, and you can pick it up at your local pharmacy. If I'm on the base or the buy-up plan, it's going to be a $25 copay. If I'm on that high deductible health plan, it's going to be a $48 encounter fee. We've listed some of the common conditions that can be treated through a virtual visit, things like a pink eye, sinus infection. You're able to seek care 24/7. I encourage you to go directly to MD Live if you haven't already to register, and then you can contact them or make an appointment on the website. This is a great feature on your plan, a way to save you time and money by being able to use this virtual visit any place in the United States. So if you're traveling on vacation and you have someone that gets sick or you're sick yourself, this is a great opportunity to be able to access care. Where to go for care? We encourage you to use urgent care or virtual visits or even after hour clinics because that can save you significant dollars out of your pocket versus going to the nearest emergency room. As you'll see from this slide, MD Live, that virtual visit's going to be the least expensive option, all the way up to one of these freestanding emergency care. That's going to be the most expensive option, regardless of which plan you're on. These freestanding emergency care clinics have gone up locally here in Texas, but they've also gone up across the US. I just want everyone to be informed. If you're going into one of these freestanding emergency rooms, there's not a hospital there tied to it. It looks and feels a lot like an urgent care facility, but here in Texas, they'll have 24/7 care on them, and that means that they are an emergency room and they'll state emergency room and they're going to charge you just like going to that hospital-based emergency room and typically more out of your pocket. Some tips and tricks, encouraging on your medication if you're enrolled in that high deductible health plan that includes that HSA, to go and price that medication through Blue Cross and Blue Shield. They direct you to Prime Therapeutics, which is their pharmacy division. You can search for that medication. You can compare pharmacy pricing. If I go to the local HEB versus going to the local Walgreens and I'm picking up the exact same medication, it actually will be two different costs. For me personally, on my medication, typically it's cheaper if I'm going to HEB or to a Costco or Walmart versus the big chain like a Walgreens. So encourage you if you're taking medication and you're on that high deductible health plan to price that medication to see where you can get the best deal. Ask your physician for samples. If he or she is giving you a new medication, they typically have some samples in their pharmacy closet and they can give you some samples to give you time to shop around to see what pharmacy has the best deal. You also have a mail order vendor that you can use through Express Scripts for your long term or maintenance medication. And then there's also the specialty medication pharmacy as well. Hopefully, you've all registered for your Blue Access for members through Blue Cross and Blue Shield. You can do this through your phone, you can do it through your computer on the website. They have a lot of tools there. Once you register, you're able to see your account, you're able to see those explanation of benefits or EOBs. This tells you how much you really owe that in network provider. You're also able to use a cost estimator tool. Maybe your provider has stated that you need to get an MRI or you need to get a CAT scan for whatever reason. You can use that cost estimator tool to see who has the best price for that particular treatment based on your zip code. It's a great tool. You can also always print and request your ID card. I have my ID card through the app, so anytime I forget it, I can just pull out my phone and show them my ID card if needed. A great feature that we forget about often is we have a 24-hour nurse line. With that 24-hour nurse line, um, we have access to a registered nurse. Doesn't matter if it's a holiday or not, it's 24 hours a day, 7 days a week. And they can really help us with anything from some basic information to triaging a problem and letting us know whether or not we need to get to the nearest emergency room or if that situation can wait until the next morning when the doctor's office opens up. So if you haven't taken advantage of it and the need arises, I encourage you to remember about this toll-free nurse hotline, and remember there's no charge for you using it. It is a free service. The Blue Cross and Blue Shield of Texas has several programs available to you. We've listed some of these on the screen. If you go through and log in through the Blue Access for members, for example, you can get to the Blue 365. It's a discount program. There's a discount on a fitness gym membership. There are discounts on healthy eating, on vitamins, on workout clothes. It really varies, but a great resource you have. Well on Target is a program they have with some wellness resources as well as some gift cards depending on if you hit certain metrics. So lots of programs out there. Encourage you to take advantage of them. They're included with the medical insurance. We've listed a claims example because we often get the question, which plan's best for me? I've been doing this for several years, and every year I step back and I look to see what's going to happen next year. What do I already know that myself or any of my covered kids are going to have? And then I try to see what plan would be best for me based on that information. With this, we have an infrequent user. They get their annual preventative care covered at 100%, regardless of which plan they select. They have a primary care office visit. That contracted rate's $100. So on that high deductible health plan, I'd have to pay that $100 out of my pocket because I have not met my deductible. On that base and buy-up plan, it's a $25 office visit copay. This employee is on a monthly maintenance prescription. So under that prescription, they're taking it every day, 365 days of the year. The contracted rate's $20. So on the high deductible health plan, we took that $20 times 12. On the base and the buy-up, we took that $10 generic copay and multiplied it by 12 months. Then you'll see an urgent care visit and a specialist visit. So total medical cost incurred, this is what came out of my pocket when I went to the doctor's office or the pharmacy. $865 on the high deductible health plan. The base and the buy-up, $295 versus $270. There's a difference there in the urgent care visit, making that dollar difference there. If I'm an employee making less than $48,000 a year, then we'll note our annual premium cost here. And then about midway or a little past half the page, you'll see total annual cost. So again, if I could predict the future, this base plan looks great at $295. The buy-up $773 and the high deductible health plan's $865. Same situation, same scenario, but this is different because our annual premium cost for these employees that make more than $48,000, we've noted here at the bottom to come up with those different numbers. The next one is a frequent user. Under this example, this employee has met their out-of-pocket maximum. They've blown out their knee, they had to have an MRI, they had to have knee surgery. So a lot of expenses going on for this employee. So again, out-of-pocket maximum per individual, $3,300 on the high deductible health plan, $6,500 for the base plan, and $5,000 for the buy-up plan. We took each scenario again and added in that annual premium cost so you could see what those total annual cost would be. Again, that's including how much I pay out of my paycheck every pay period, plus how much I paid in total expenses towards my deductible, copays, or coinsurance. This is your medical rates. I'm not going to spend a lot of time on this page, but these rates are also included when you walk through ADP for your enrollment and also in your benefit guide. The health savings account is going to stay with WEX. Again, as a reminder, you have to enroll in the high deductible health plan in order to open up a health savings account. A health savings account is your personal bank account in your name that you can put tax free money into for medical, dental, and vision, not only for yourself, but also for any of your IRS covered dependents. Any unused balances are going to accumulate over time. There is no use it or lose it penalty under this plan. So, who qualifies to open up an HSA? Again, you have to be enrolled in that high deductible health plan, not covered by a non qualified health plan. And this includes Medicare or coverage through your spouse, not claimed as a dependent on someone else's tax return, and not participating in a traditional flexible spending account. And this includes your spouse as well. You will receive a debit card if this is your first time to enroll in the HSA. If you're currently on the HSA and continuing, just check your expiration date on that debit card. If it's going to expire, they're going to just automatically issue you a new one. Each year, the IRS gives us a dollar amount maximum that we can put into our HSA. Remember, as a reminder, these are tax-free dollars, so we are limited in how much we can put into our HSA each year. So for the 2025 calendar year, it's $4,300 for employee-only coverage. If I'm covering my spouse and dependents, it's $8,550. Also important to note is that if I have money in there today, maybe I had a great year last year and I've got $3,000 left over into my HSA, that just rolls over into the new year. I don't lose that money and I can continue to add dollars into my HSA. A lot of people are looking at the HSA as their mini 401k plan for medical expense purposes after they retire. Because even after I retire and leave Build a Sign, those dollars are mine and they stay with me. This is one of the only accounts that gives you a triple tax advantage, meaning that the money I put in is tax free. My HSA account is going to grow tax free as I put those dollars in different investment vehicles within the HSA. And then when I take that money out, it is going to be tax free as long as I use it for eligible medical, dental, and vision expenses. Flexible spending account. The FSA, also referred to as the healthcare FSA, is going to be for those employees that select the base or the buy-up PPO plans. Again, we are putting tax-free dollars into an account. So that money's coming out of my paycheck on a tax-free basis. I'm setting it aside into a healthcare FSA. I can put up to $2,000 in that for the 2025 plan year. So from May 1st, 2025 to April 30th, 2026. And I can use those dollars for any medical, dental, and vision expenses. If I know that I go to the doctor every month and it's a $25 copay, I can take $25 times 12 and put those dollars into my healthcare FSA. And then every time I go to the doctor, I can just swipe my debit card from WEX, and that's how I can pay for those office visit copays. It is important to note that this is a use it or lose it account. So we advise for you to be very conservative with the money that you're putting into the healthcare FSA. I would not put money into the account thinking, I might use it. I might go get that crown that I need. You need to be 100% for sure that you have the expenses to match up with whatever money you're putting into this healthcare FSA. The dependent care FSA, again, works very similar. You're putting tax-free money in to pay for out-of-pocket cost for daycare while you and your spouse are working. As a reminder, with the dependent care FSA, this isn't for date night, it's not for a babysitter on the weekend. This is truly for things like after school care, for daycare facilities, for summer camp, but it does not include any overnight stay. So it's for care of your children up to the age of 13 while you are working. For the 2025 plan year, you can contribute up to $5,000. This has the same use it or lose it provision. So please be 100% for sure that you're going to have the expenses to match your contribution. And please keep all of your itemized receipts for both the healthcare FSA and the dependent care FSA. Dental. There's been no changes to the dental plan. We're still offering the base and the buy-up plan. These are great dental plans. Always encourage you to stay in network, just like the medical. We encourage you to always stay in network. By staying in network with these plans, you will reduce the amount that you can be balance billed. An in-network provider cannot balance bill you like an out-of-network provider. The two big differences on the base and the buy-up plan. My calendar year maximum under the base is $1,000 per person. Under the buy-up plan, it is $2,000 per person. And the other difference is the orthodontia care. If I need braces for my children, the base plan is fine. But if I need braces for myself as an adult, then I would want to select the buy-up plan because that does cover adult orthodontia. Just an example of the in and out of network benefit on the dental plan. Again, encouraging you to stay in network. We always encourage employees to go get those semi-annual cleanings. If you'll note on the prior slide, preventative care such as cleaning, x-rays, and oral exams are covered at 100%, and that deductible is waived. That is true as long as I'm going in network, because in network, that Blue Cross and Blue Shield dentist has agreed to that contracted rate. However, if I am going out of network for services, then I have the risk of being balance billed. And 99% of the time, I will be balance billed if I'm going to an out of network dentist. So in this example, you can see I went in for one of those semi-annual cleanings, and I'm going to owe $25 because that out of network dentist did not accept the Blue Cross and Blue Shield payment in full. $25 may not seem a lot to you, but if I'm going in for something major like a crown, then this is going to change these dollar amounts, and it's going to be a much greater dollar amount that I'm going to owe out of network. We've listed the website here, and again, your network is the Blue Care Dental. Encourage you to find an in-network dentist, especially if you're getting a high dollar item such as a crown done. One last piece of advice on the dental insurance is that if I'm going to get dental care and it's going to be for services more than $200, I encourage you to request what we call a predetermination of benefits. Your dentist office will submit to Blue Cross and Blue Shield a treatment plan, and Blue Cross and Blue Shield will calculate how much they're going to cover and what your out-of-pocket expense is going to be and send it back to your dental office. Again, if you know you're going in for a big ticket item, and really encourage you to do that before getting your services, so there's no surprises. Next is your dental rates. Vision, there's been no changes to the vision. Everything's staying exactly the same. Remember, I can get an eye exam for $10 or a $25 prescription glasses. As a reminder on the vision, I can either get glasses or contact lenses. And we want to note on the frequency, it's based on a date of service. So if I go and get my eye exam done today, March 17th, 2025, I have to wait 12 months from today's date to get my next eye exam. These are the vision rates. Again, they're included in ADP and your benefit guide. There's been no changes to the life AD&D. You work for a great company that provides you a $50,000 basic term life and AD&D policy. If something was to happen and you passed away, then your beneficiary would receive a $50,000 payment from Lincoln Financial. As we go through open enrollment, we always encourage you to update your beneficiary information. Things change. We could have a new spouse, new boyfriend, new girlfriend, whatever the case might be. We just want to make sure that that beneficiary information is accurate and who you really want these funds to go to if something happened. You also have the opportunity to purchase additional voluntary life insurance for yourself, spouse, and children. You must purchase it for yourself as an employee before you can make that additional purchase for your spouse and children. Please note that the guarantee issue amount listed is strictly only for newly eligible employees, so for new hires. Again, if you want to keep this benefit exactly the same, it will roll over through open enrollment. The only change is sometimes if you have one of these 5-year age bracket changes. So I'm going from 39 to 40, 34 to 35, then my rates will increase as I increase through that 5-year age bracket. You work for a great company that provides you both short and long-term disability coverage. Another term I like to think on for disability is income replacement. If I become disabled and can no longer work, how am I going to pay the bills? How am I going to buy the groceries for the kids? How am I going to pay the rent or the house payment? With short term disability, it helps us during that short term. So, after I've had satisfied my elimination period of 14 days due to an accident or illness, I'd start receiving a benefit of 60% of my weekly earnings up to $1,500 per week. I will potentially receive that for 11 weeks. The benefits end the earlier of your physician determination or 11 weeks. If my disability continues, then it rolls into what we call a long-term disability. Under the long-term disability plan, I receive 60% of my monthly earnings up to $6,000 per month. My elimination period satisfied during that short-term disability period of 90 days. I can potentially receive my long-term disability payment um, until my physician determines I'm no longer disabled or Social Security normal retirement age. Employee Assistance Program, also referred to as an EAP. You have free access to your EAP program through Lincoln Financial. With the EAP, it can help you with so many things. Maybe you have older parents that you need help finding support or care for them. Maybe you have young kids and new to the area and you need help finding a daycare provider. Maybe it's a legal issue. Maybe you've lost a loved one or you have a stressful relationship going on that you just need to talk to someone about. You have up to 4 face-to-face visits free of charge. They've provided you with the 800 number as well as a website. The one thing I want you to remember about the EAP is there's no cost to you and it's 100% confidential. So there's no report going back that says Rebecca called the EAP 2 times this week. Nothing like that. So a great program available to you and your dependents. You have an accident and critical illness plan through Blue Cross and Blue Shield. This is what we consider voluntary insurance. This is not health insurance. It's not designed to replace health insurance. We need those medical plans through Blue Cross and Blue Shield to cover the treatment of our hospitals and doctors and pharmacies. Voluntary insurance pays us money directly to us as an employee. It's designed to help with out of pocket expenses, and it's designed to supplement our health insurance. We've all seen the duck commercials at night, Aflac. This is considered like an Aflac plan, except it's through Blue Cross and Blue Shield. Accident, uh, they have a schedule of benefits. You see these benefit highlights listed on the screen, but there's a schedule of benefits in your benefit guide that goes into more detail. But if you are hurt due to an accident, then they will pay you based on the services you receive. For example, I've got a daughter who played basketball and she ended up with a concussion. So I was able to get coverage because I took her to the urgent care. I got a $75 copay, $75 check back to me. I also got $25 because she got an x-ray done. Um, there's also a wellness benefit here. So even if I'm just going in and getting my annual adult physicals, I can submit a claim and get a $40 wellness benefit once per year. The covered accident must occur on or after the effective date. So if I'm new to the policy, effective May 1st, my accident must be from May 1st or going forward while I am covered under the policy. And the last note is that this is just a small example of the benefits, and these dollar amounts can add on top of each other. Critical illness pays you a lump sum, either 10,000 or 20,000, depending on which benefit option you select during open enrollment. And it's going to pay you for these illnesses listed: cancer, heart attack, stroke, major organ transplant, or end-stage renal failure. So critical illness is different than the accident plan. Again, it's paying you a flat amount. If I elected this benefit effective May 1st, and then on October 1st, I had a heart attack and I had selected $10,000. I'm going to submit a claim. It's going to be reviewed, and then Blue Cross and Blue Shield will send me a check back for $10,000. I can use that money at my own discretion. I can use it to pay for bills. I can go on a shopping spree, on a trip, whatever the case might be. Those are my dollars to use. I'm still going to have my deductible and my medical expenses, so I could use them to offset what I'm having to pay through the medical plan as well. Important to note is that there is a wellness benefit here as well of $50 once per person each calendar year. If you're currently on this plan and you have gotten your annual adult physical, mammograms, there's a list of things that qualify under the wellness benefit. You can submit a claim and Blue Cross and Blue Shield will send you a check back for $50. Enrollment. We are going to enroll through ADP again this year. We've listed the steps here through the ADP Workforce Now website or through the mobile app. It's important to note that we're having what we call a passive enrollment. So if I'm happy with all of my benefits, those benefits are going to roll over with the exception of the flexible spending account or the HSA. If I want to continue the flexible spending account, and that includes the healthcare spending account or the dependent care spending account or the health savings account, I must re-enroll for these benefits each year. That is an IRS regulated account, and they do require you to re-enroll. So important to note, you must get out into the ADP system and re-enroll if you want either the FSA or the HSA. Otherwise, if you don't have those benefits and you're happy with what you have, they are going to roll over and just continue for the new plan year effective May 1, 2025. You also have access to the Benefit Advocate Center. With that, there's a toll-free number, there is an email address. They can help you with a variety of different things. Maybe you don't know if you really owe the money to the doctor's office. Maybe you need help finding a provider or ordering an ID card. These are just examples of the Benefit Advocate Center services. This concludes the open enrollment meeting. Thank you so very much for attending.